If you've ever had that sort of burning sensation rising up in your chest, or a gnawing pain in the top of your stomach, or that horrible acidic taste at the back of your throat after a meal, then you've probably already heard of the medications I'm going to talk about in this video. And there is a good chance actually that you're probably already taking one of them. I'm talking about proton pump inhibitors, PPIs, things like omeprazole or lansoprazole or esomeprazole. Different names, but the same class of drug, and they all basically do the same thing. And I want to tell you about my own experience with these, because I went from taking one of the highest doses of lansoprazole twice a day to not taking them at all. And the thing that got me there wasn't a new medication or a procedure. It was changing just two things in my life that are completely free and have zero side effects. And I'll talk more about that later on. But I just want to say up front that I've seen thousands and thousands of patients over the years who have these tablets listed on their medication record. And I firmly believe that a significant proportion of them do not need to be on them. If people made just a few small tweaks to their daily habits, many of them could come off this medication entirely, under proper medical supervision, of course. And the reason I say that is because for a lot of people, the reason they have these symptoms is because of their lifestyle. And that's what this video is all about. So we're going to talk about what these tablets are, how they work, what the long-term risks actually are, and what these lifestyle changes look like that could make these medications completely unnecessary for a lot of people. Hello, I'm Dr. Alex. I've worked in emergency medicine for a decade, and now I'm sharing everything I know with you to help you prevent the diseases that I see all the time. And if you learned something from this video today, then all I ask is that you support the channel by liking the video and subscribing. It honestly really does make a massive difference. So let's talk about what these medications are and how they actually work. So your stomach produces acid to break down food and kill harmful bacteria that come in with what you ate. The cells lining your stomach have tiny little pumps on them called proton pumps that push acid out into the stomach. Now, a proton pump inhibitor, a PPI, works by blocking those pumps. It essentially turns the taps off. Less acid being produced means less acid splashing back up into the food pipe, the esophagus, which is what causes that burning pain that most people know as heartburn or acid reflux that can go up into the chest and then spread across as well. Now, when that happens regularly, we call it GERD or GERD, G-O-R-D or G-E-R-D, depending on where you are in the world, gastroesophageal reflux disease. Now, PPIs are very good at controlling the symptoms. Now, they're also used for ulcers in the stomach to help clear a stomach infection called H. pylori and to protect the stomach lining in people who take strong painkillers long term, things like naproxen or ibuprofen. In the short term, they really are genuinely effective, and the evidence absolutely supports using them in certain circumstances. The problem, though, is what happens when the short term quietly becomes years and decades. But why do people actually get acid reflux in the first place? Well, reflux happens when stomach acid travels back up into the esophagus, the tube that connects your mouth to your stomach. There is a ring of muscle at the bottom of that tube called the lower esophageal sphincter, and it basically acts like a valve. It's supposed to let food down and then shut tightly afterwards, but when it doesn't close properly, acid in the stomach can get back through. Now, the symptoms of this stomach acid in the esophagus where it's not supposed to be is burning chest pain that most people recognize as heartburn. Most people have had this at some point. And it's often worse after eating or when lying down, when gravity isn't there to sort of pull the acid back down, if that makes sense. Sometimes you get a sour taste in the back of your throat or in your mouth, sometimes a cough that won't go away, or a feeling of something sort of stuck in the chest, like you've swallowed something and it still feels like it's stuck there. There are loads and loads of different symptoms of this. The important thing is if you have chest pain to rule out the serious things first, and that's why it's always important to go to your doctor or to the A&E depending on the circumstances. And also, if you are pretty certain that it's reflux and nothing more sinister, but you're getting these symptoms regularly, then you have to get checked out by your doctor rather than just sort of self-medicating, because in some cases, you may need an endoscopy, which is a camera test that looks down the stomach and the food pipe. And the reason we do this really is to make sure there's nothing more serious going on. Most of the time, there isn't, but those symptoms can occasionally be an early sign of something that needs to be caught early. And that test exists for a reason, so don't ignore it. Now, a hiatus hernia, which is where part of the stomach pushes through the diaphragm, the muscular sheet sort of separating your chest from your abdomen, makes reflux worse because it physically changes the angle of that valve and makes it easier for acid to escape upwards. But the structural issue is only part of the story, and this is where I think medicine often gets it quite wrong. So my own story with these tablets is that I was prescribed lansoprazole by my doctor many years ago before I even started medical school, after going to them with horrible burning pains spreading across my chest, the kind where I would literally, and I mean literally, run to the kitchen at night, mix baking soda or bicarbonate of soda with water and just drink the whole thing. And that was the only thing that I could think of that would get rid of these symptoms. Now, obviously, I don't recommend doing that. It works in the moment, but it is not a treatment. I do not recommend doing that. But my doctor put me on 30 milligrams of lansoprazole twice a day, which is a pretty high dose to be prescribed. And I stayed on that dose for years, literally years, and nobody ever explored my lifestyle with me. Now, I actually had a camera test and they saw a hiatus hernia, which we just talked about. They saw part of my stomach poking up, and this is actually quite common. So there was a structural cause there, or there still is a structural cause there, to explain the symptoms that I had. But looking back, I think the more obvious cause was the things that I was doing at the weekends with my friends. So I was a college student drinking too much alcohol too regularly, as most of us did. I didn't really drink in excess, but when you get to that age, you start going out, you start hanging out with your friends, going to the pub, and I was eating late at night as well, not sleeping well. And this normal student life really exacerbated my symptoms massively. This was the perfect recipe for acid reflux. But my doctor, again, never once asked about any of that. Not one doctor ever explored my lifestyle. The prescription was written, I left with it, and that was that. And yes, the medication worked. It got rid of my symptoms. It was only later on when I cut out alcohol, stopped eating within 3 hours of going to bed, and almost cutting out completely ultra-processed foods, that I was able to drop to 15 milligrams once a day, so a quarter of the dose, and then eventually come off them completely. That structural cause there, that hiatus hernia, hadn't gone. But the lifestyle changes meant that the medication became unnecessary. So I saved on the prescription charge, I removed the long-term side effect risk, and my symptoms to this day still have completely disappeared. And that's the story that I want more people to hear. The problem these days really is how medicine works. We go to the doctor with symptoms and expect to leave with a medication that treats those symptoms. And that is a really big issue that is going to take a long time to overcome. Now, the things that drive acid reflux are really well established. We know the causes. And the fact that they're not discussed enough in these consultations is one of medicine's very quiet failures. Alcohol relaxes that lower esophageal sphincter, the valve, which is why drinking alcohol regularly and getting reflux is almost a guaranteed combination. Eating close to bedtime means that the stomach is still full when you lie flat, and gravity can no longer help keep everything where it belongs. If there's food in the stomach, then stomach acid will be produced by your stomach to help digest it. So if you eat close to bedtime, then it's probably going to cause an element of heartburn and reflux. As well as that, being overweight increases the pressure on the stomach from below, pushing that stomach acid upwards. Smoking weakens the sphincter as well. Large meals, eaten quickly, ultra-processed foods, crisps, sweets, chocolate, caffeine, takeaways, all of these either relax that valve, increase acid production, or both. Tight clothing around the waist, stress as well. These are the actual drivers for the vast majority of people, and most of them are things that can be changed for free. Now, a tablet gets rid of the symptoms, but it does not fix any of that. It just reduces the acid so the damage feels less severe, while the underlying problem continues. Now, a lot of people ask about the long-term risks of these medications, and this is obviously where it gets quite important. And I want to be really straight with you about what the science actually says and what it doesn't. So observational studies, meaning studies that watch large groups of people over time, they link long-term PPI use to a range of concerns, including gut infections, nutrient deficiencies in magnesium and vitamin B12, bone fractures as well, chronic kidney disease, and potentially some cancers, potentially. Now, that is a pretty significant list, but the crucial word here is observational. These studies show a link, not a proven cause. People on long-term PPIs tend, on average, to be older and sicker and on more medications, which makes it genuinely hard to untangle the drug's effects from everything else going on. So the risks are real enough to take seriously, but they're not a reason to panic straight away. Basically, what all of this means is that we know that there is possibly some long-term risks of taking these long-term. So surely if you can come off these medications, then that has to be safer for you. Now, the nutrient story is probably the most clinically solid part of all of this. So because stomach acid is needed to release vitamin B12 from food so the body can absorb it, PPIs reduce that process, and magnesium absorption is also affected as well, with several reports linking long-term use to low magnesium levels in the blood. Now, studies have shown a 12 to 18% reduction in vitamin B12 levels over 12 months of PPI use. And calcium absorption is also reduced, which matters enormously for your bone strength over time. Low magnesium might not sound dramatic, but magnesium is involved in over 300 processes in the body, including muscle function, nerve function, your heart rhythm, your blood sugar control. And severe magnesium deficiency, actually from long-term PPI use, has caused documented cases of serious heart rhythm disturbances and muscle spasms as well. If you are on long-term PPIs and nobody has ever checked your magnesium or your B12 levels, then you need to have that conversation with your doctor. On cancer specifically, what the evidence seems to show, and again, it's not been proven, but what it seems to show is that prolonged PPI use exceeding 3 months is associated with an elevated risk of certain cancers, including gastric, esophageal, and colorectal cancer, though the precise mechanism is still being worked out. Like I said, this isn't factual yet. One proposed reason is that by suppressing acid so powerfully, PPIs change the environment in your gut, altering the bacteria living there and potentially allowing cell damage to go on longer than it otherwise would. Now, a large study from Hong Kong found that long-term PPI use after treating an H. pylori infection was associated with a higher risk of gastric cancer, although underlying damage to the stomach because of the infection might explain part of that finding. Again, it's association, not proof, but it's worth knowing about if you've been taking these tablets for years without anybody ever reviewing whether you still need them or not. And then a lot of people ask about dementia risk as well. And this one genuinely is quite complicated. And we've got to be quite fair to the evidence here. A large study tracking over 5,500 older adults found that those who had taken PPIs for more than 4.5 cumulative years together had a 33% higher risk of developing dementia compared to those who had never taken them. Now, that sounds obviously quite alarming, but the more rigorous types of analysis called a Mendelian randomization study, which is better at ruling out these confounding factors, found no significant causal link between PPI use and dementia across any of the common types. The honest position here is that the observational data raises a question, but the better quality evidence doesn't confirm it as a direct cause. Most guidelines don't currently list dementia as a proven risk, but again, the signal is there, and it's another reason that staying on these tablets without regular review If you can avoid them, it just doesn't make sense. But obviously, some people absolutely do need to stay on these PPIs, and that needs to be said quite clearly. If you have Barrett's esophagus, which is a condition where the lining of the food pipe has changed in a way that really raises your cancer risk, long-term PPIs are absolutely protective and important. If you've had bleeding from a stomach ulcer, or you're on blood thinners or strong anti-inflammatory tablets like ibuprofen, then these often need to stay part of your regular medications. Severe esophagitis, where the food pipe is genuinely inflamed and damaged, is another solid indication as well. The problem though is that I would say most patients are given these medications for none of those reasons. They were started for heartburn years ago. The heartburn then settled because the medication was doing its job, and the tablets just kept appearing on the repeat prescription without anybody asking whether they were still needed, whether there were any lifestyle factors that could be addressed. So what can you actually do about all of this? So the lifestyle changes that reduce reflux are not glamorous, they are not exciting, but they do work. And I say that because I have lived it. I introduced some of these habits and my reflux symptoms went completely, even though I still have the structural issue, the hiatus hernia, that we thought was the main driver. Now, stopping eating at least 2 to 3 hours before bed is probably the single most impactful change for most people, because lying flat with a full stomach is just the perfect setup for reflux. Alcohol as well, so cutting back significantly or stopping completely if you can, removes one of the primary triggers for that valve failing to stay shut. And then we've got food, which is so important. The ultra-processed stuff, the fizzy drinks, the late-night chocolate and crisps or chips, whatever, the big greasy takeaways, all of it either relaxes the sphincter, increases acid production, or slows the stomach emptying, which means more time for acid to splash back up. Eating smaller meals as well, rather than large ones, and not rushing food matters as well. Losing weight, if you're carrying excess around the middle, reduces that physical pressure on the stomach from below. Elevating the head of the bed as well, just a few inches, can make a real difference if your symptoms are worse at night, because even just a small angle means that gravity is working in your favor. Acid will flow back down a bit more easily. And if you're currently taking lansoprazole or omeprazole or esomeprazole, and you've made these changes and your symptoms have improved, then talk to your doctor about a step-down approach or switching from daily to on-demand, what we call PRN use, only when your symptoms actually show up. The important thing here is not to stop these medications suddenly without guidance, because acid production can actually rebound temporarily and your symptoms can feel worse before they settle down. The bottom line for this video here is that PPIs are genuinely really useful drugs for the right person at the right time, and there are people who need them long term and should not stop them. But far too many people are on them for far too long. We are essentially prescribing these to treat bad lifestyle habits that are just part of our culture now. And we prescribe them at doses that are never reviewed for symptoms that are never properly investigated, with lifestyle causes that are never discussed. If you are on one of these tablets, then the most useful thing that you can do is book an appointment with your doctor. Ask when you were last reviewed, ask whether the dose is still appropriate, and ask whether anybody has ever talked to you about what was driving the problem in the first place. And if you're getting symptoms that are new or getting worse, or you've never had a camera test, a gastroscopy or an endoscopy, then absolutely push for one. That conversation and those lifestyle changes could get a lot of people off a medication they've been on for years without ever really needing to be.